Welcome to BCBA Exam Prep, Section F, Behavior Assessment, based on the 6th edition task list. In this section, we focus on how BCBAs identify meaningful behaviors, understand why they happen, and decide what type of intervention is needed. Assessment is not just data collection. It is the foundation for ethical and effective treatment. Everything that follows in treatment planning depends on the quality of your assessment. For realistic BCBA-style practice questions and case scenarios, visit www.bcbmarkexam.com. To succeed on Section F questions, always ask yourself 4 things. First, what is the goal of the assessment in this situation? Second, which assessment method best fits that goal? Third, what does the data actually show, not what you assume it shows? And finally, what clinical decision should be made next? On the exam, many questions are not testing definitions. They are testing professional judgment and next step decision-making. Section F includes several major assessment components. You will see questions about reviewing records and background information. You will assess skills, preferences, and patterns of behavior. You will also evaluate behavior using descriptive and experimental methods. Finally, you must decide whether services are needed and what behaviors to prioritize. All of these pieces work together to guide treatment planning. Records review is always an early step in assessment. This includes educational reports, medical history, previous behavior plans, and therapy notes. These records provide insight into learning history and prior interventions. They can also reveal medical risks or environmental changes that affect behavior. Skipping this step increases the risk of poor assessment decisions. Records help identify long-term patterns that may not appear during short observations. They help prevent repeating ineffective or harmful strategies. They also support collaboration with other professionals. Records review helps clarify diagnoses and developmental history. A common exam trap is choosing direct assessment when records already explain part of the problem. Culture strongly influences how behavior is defined and interpreted. Family values, communication styles, and expectations affect both behavior and treatment acceptance. What one culture views as problematic may be typical in another. Assessment must consider these variables to remain socially valid. Ignoring culture can result in inappropriate goals and poor treatment adherence. Culturally informed decisions involve active collaboration with caregivers and clients. Goals should reflect what is meaningful to the family. Intervention procedures may need modification to fit daily routines and traditions. Language access and communication preferences are also critical. On the exam, cultural considerations often affect whether a goal is appropriate, not whether it is technically possible. Skill assessments identify what the client can and cannot do. They help determine readiness for learning and independence. They also guide instructional sequencing. Without skill assessment, intervention may focus only on reducing problem behavior, but effective ABA always includes building adaptive skills. Common assessment tools include VB-MAPP, ABLLS-R, AFLS, and curriculum-based measures. These tools organize skills across domains and developmental levels. They are useful for tracking progress over time. However, scores alone are not enough. Direct observation and functional performance matter more than checklist completion. Preference assessments help identify potential reinforcers. They increase motivation and participation during instruction. They also reduce reliance on trial and error reinforcement selection. Different clients require different assessment formats. Assessment should match the client's communication and motor abilities. Free operant allows observation of natural engagement with many items. Paired stimulus presents 2 items repeatedly to build a hierarchy. MSWO presents several options and removes selected items across trials. Caregiver interviews provide indirect but useful background information. On the exam, method selection is often based on efficiency and client ability. Preference simply means the client chooses an item. Reinforcement means the behavior increases because of that item. An item can be preferred but not function as a reinforcer. Therefore, reinforcement must always be confirmed through data. A frequent exam mistake is treating preference data as proof of reinforcement. Descriptive assessments involve observing behavior in natural environments. No variables are systematically manipulated. They identify patterns between antecedents, behavior, and consequences. They are useful for generating hypotheses about function, but they cannot confirm causation. ABC continuous recording tracks events as they occur. ABC narrative provides detailed qualitative descriptions. Scatterplots show temporal patterns across days or routines. Each method reveals different types of information, but none can isolate controlling variables with certainty. Descriptive data often reflect correlations rather than functional relationships. They may miss subtle environmental variables. They can also be influenced by observer bias. Because of this, treatment based only on descriptive data may be ineffective. Exam questions often ask when additional assessment is required. Functional analysis systematically manipulates environmental variables. Specific conditions are tested while measuring behavior rates. This allows identification of the function maintaining behavior. FA provides the strongest evidence for treatment selection. It is considered the gold standard for functional assessment. Attention condition tests for social attention reinforcement. Escape condition tests for task avoidance. Tangible condition tests access to preferred items. Alone or ignore conditions test for automatic reinforcement. Play serves as the control condition with free access and no demands. Comparing rates across conditions reveals function. Functional analysis is often used for severe or dangerous behaviors. It is used when descriptive data are unclear or conflicting. It is also used when treatment failures have occurred. However, safety and feasibility must always be considered. FA requires careful planning and risk management. Not all behavior concerns require intensive ABA services. Service need is based on severity, frequency, skill deficits, and risk. Environmental supports also affect service intensity decisions. Assessment should justify why services are recommended. This protects both clients and service systems. Some conditions require medical or psychiatric evaluation. Others may need speech therapy, occupational therapy, or counseling. Ethical practice includes recognizing limits of ABA. Failing to refer can delay appropriate care. Exam questions often test interdisciplinary decision-making. On TRAP is trying to treat everything with ABA instead of referring out. Target behaviors must be socially significant. They should improve quality of life and independence. They must align with family priorities and cultural values. Target selection should never be based only on convenience. Good goals reflect meaningful life outcomes. Safety-related behaviors are always highest priority. Communication skills often replace problem behavior. Daily living skills support long-term independence. Access to reinforcement supports engagement and learning. Reducing behavior without teaching replacement skills is not sufficient. No single assessment method should guide treatment alone. Records, observation, skill data, and FA results must be integrated. Consistent patterns across methods increase confidence in decisions. Data integration supports individualized treatment planning. On the exam, look for answers that use multiple data sources. Choosing assessments based on habit rather than purpose. Ignoring cultural and contextual factors. Misinterpreting descriptive correlations as function. Failing to justify service recommendations. Section F often tests professional reasoning, not memorization. Assessment guides every treatment decision. Use the right tool for the right question. Respect the client's context and values. Let data guide your conclusions. Function should always guide intervention. For more BCBA exam practice and case-based training, visit www.bcbmarkexam.com.